Welcome, everyone. I'm Puneet Seth, Managing Principal at TELUS Health and a practicing family physician here in Toronto, Ontario. I'm looking forward to exploring this bold statement that's in front of you right now, which is that the future of healthcare is collaborative. Regardless of where you are, we're sharing a reality, which is that our healthcare system is being challenged in every way possible due to the COVID-19 pandemic. While as healthcare providers, we're already very used to being highly collaborative with our colleagues and our healthcare teams. What the pandemic has done, it's really exposed the fact that the key technology that we use on a day-to-day basis, namely the electronic medical record, historically doesn't really help us communicate with one another. It doesn't help us coordinate care. It doesn't help us involve the patient in participating in their own care. Realities that are important not only in the context of the times we're in right now, but really things that we know have been pain points for healthcare delivery for now well over a decade. How can we rethink the role of the health record from being a tool of documentation to being a tool of healthcare delivery and communication? And could this change in the focus of the health record reduce the steps and inefficiencies in our day-to-day work and actually allow us to focus on what we want to do, which is to deliver the best healthcare possible? This is what I'm hoping to be able to explore today. So briefly, I'd like to speak about my clinical and professional journey, as I hope it'll provide a little bit of context for today's discussion. I've been a practicing family physician in Toronto for the past 10 years, graduated just down the road from McMaster University. And clinically, I've had the fortune of working in a variety of different settings. I've worked as a hospitalist for a number of years at a number of community hospitals in Ontario. I worked at an academic family practice, and presently I run a community family medicine practice in downtown Toronto, where I get to leverage the collaborative health record, one of the platforms we'll be talking about today. On the technology side, I've worn many hats, and I've had the fortune of being on the team that created the next generation platform we're going to discuss today, the CHR, alongside co-founders Dr. Damon Ramsey, who's also a family physician at UBC and is now Vice President of Collaborative Health and Chief Medical Information Officer at TELUS Health, and Sean Jung, the Principal Technology Architect of the Collaborative Health Record. We've had a brilliant team that's powered the capabilities of what we're doing. And this has led to me being able to utilize the CHR in my own practice since its inception. For the last 8 years, I've had the chance to meet and work with hundreds of fellow doctors and colleagues across the country that have been wanting to make a transition in their practice and to use the collaborative health record and to rethink about the way in which the platform can be used to be able to deliver care. This has been a humbling and eye-opening experience, and I'm hoping to share some of these insights today as well. Before we talk any further, I want to bring the patient story to the center of this conversation, because ultimately that's why we do what we do every day. So this is a de-identified patient, let's call him Joe, whom I saw in my own practice not long ago. 67-year-old gentleman, lives alone in the city. His children are in the United States. He's a retired engineer. He has a relatively complex past medical history: hypertension, hyperlipidemia, gout, prediabetes. He unfortunately suffered a stroke 2 weeks ago, and he was discharged from a local hospital, told to follow up with his family physician, who unfortunately retired earlier in the year. So he came to me. I'd never met him before on a walk-in clinic basis. He was holding a couple of pages of notes that were handed to him from his recent hospital discharge. And quite honestly, he was feeling completely isolated and obviously very worried about his health. So looking at his discharge note, and fortunately, there were very detailed instructions, as there often are, about a post-discharge plan. I was reflecting on the fact that what this gentleman really needs, as we often know, is quite a number of different things. But most of these things involve having a team available to him to be able to coordinate his care and to allow him to be able to focus on returning, getting back to his feet. So there were a large number of people that were needed. There was the neurologist that he had to follow up with to determine how much longer he needed to be on his dual antiplatelet therapy. There's the endocrinologist that he was suggested to follow up with to discuss his prediabetes. He needed to see a dietitian to be able to discuss his diet, SLP. And I was thinking to myself, he probably needs to see a mental health professional as well, given some of the struggles that he's having in his current predicament and being isolated. So when you pause in this moment and think about what needs to happen, you realize that the traditional model of the electronic medical record in isolation does not help facilitate any of this. There's a daunting amount of work that you need either to engage your clinic staff with, which in and of itself requires communication with your clinic staff, or that you try and do yourself. This story is in no way unique, and with the rising complexity of issues that our patients have, we need to be able to have tools that allow us to better be able to collaborate, to be able to coordinate the complex care needs that our patients need. So each and every one of us is working incredibly hard, as are our colleagues on our healthcare teams, be they nurses, occupational therapists, social workers, admin staff, their physicians. Most of us just aren't feeling like the tools that we have are actually making our lives any easier, or that those tools even really understand the realities of what it means to deliver care. And truthfully, when electronic medical records were developed, they were developed for the purposes of being able to serve very specific functions, which was to support billing and to support diagnostic registries, to be able to allow the documentation of these clinical interactions. They were never really intended to be able to facilitate communication or collaboration or care coordination. On top of this, if you think about it, the patient is usually not included in their own health record. They're not an active participant in their own care and their own information. There's often complex mechanisms that are required in order for patients to even get to see or know or access information that exists in their file. And when I think of somebody like Joe, the reality is no one's going to be as invested in his improvement as Joe is. So this really, I think, comes to the center of the conversation around how do we bring Joe into the process. So let's explore this a little bit further based on tools we have today. So what is possible with heritage or traditional EMRs today? So within the TELUS Health ecosystem, there already exists a variety of ways in which care teams can interact with patients by leveraging tools that can interact with TELUS Health EMRs. This could be done through the availability of add-on tools like Pomelo or through Ocean, for example. So Pomelo facilitates online appointment booking, appointment reminders, and messaging. And all of these things can help reduce administrative cost and time, freeing up resources to better support care in other ways. Ocean, on the other hand, can help with pre-visit questionnaires and outcome tracking, allowing, again, the patient to have a voice and to be engaged in a structured manner, and for the collection of that information into the platform. And these tools interact with a wide variety of TELUS Health EMRs, including MedAccess and Practice Solutions. This could also be accomplished through the integration of, again, traditional EMRs within the TELUS Health portfolio and tools that facilitate provider collaboration, such as MedDialogue. So these tools, like MedDialogue, facilitate provider-to-provider communication, so secure communication between clinics. In the case of Joe, this would have allowed me to be able to message or reach out to a neurologist that is working at a different clinic, so something that can be hugely valuable. In the cases previously highlighted, what we're looking at is making EMRs work better through functional add-ons and enhancements, helping thereby minimize this gap in functionality. But what if we stop for a moment and think about the health record differently? While we know EMRs have traditionally focused on documentation, billing, schedule, etc., what if the health record was actually intentionally designed instead to focus on engagement and care delivery? What if it was actually designed to help us do our jobs better as the core purpose for how it was developed? What would this look like? And what kind of impact could this happen on a day-to-day practice? And this is, of course, what I'll be talking about in detail today, which is what we've accomplished with the Collaborative Health Record, or CHR, a modern cloud-based platform that allows patients and care teams to work together towards better health. A recent addition to the TELUS Health family, the CHR is a paradigm shift in how we think about electronic health records. And presently, it's being utilized by thousands of colleagues across the country, primary care and specialist care alike, and of course, something I've been utilizing since its inception in my own practice. Importantly, as a true cloud-based solution, no proprietary software needs to be installed on the local devices. So this is run through Google Chrome exclusively. Now let's briefly explore the CHR a little bit further and highlight what makes it different from other systems. We know that care is increasingly delivered by teams, regardless of whether that team is physically located in the same clinic or whether it's even part of the same practice. When we think about Joe, his care team includes the endocrinologist, the neurologist, the social worker, the mental health professional, and others, and of course, myself as the family physician. The CHR is designed to recognize the fact that care is not delivered in isolation, and it's not simply about yourself as a physician interacting with a computer. Instead, you're able to assign different members of the healthcare team who are involved in being able to deliver care to that person. This care team can be updated when encounters take place. So there's a way to be able to, for example, share documentation amongst all of these individuals who are within that care team. And if all the care team happen to be working on the CHR, it can also help with facilitating internal communication. And beyond simply internal secure messaging, we actually have instant chat. We have group channels. There's the ability to be able to share files. All of these things focus on allowing the care team to work together. And this digital collaboration has been all the more important during the context of the pandemic, recognizing that even for colleagues that may have been physically located in your own practice before, we're now working in remote and disparate locations. Now let's talk a little bit about the patient as part of the care team. So when we talk about patient engagement, what do we mean? In the context of the CHR actually provides a myriad of different tools in which patient and care team can interact. And let's think of all the different ways that you can imagine that. This could be through a patient wanting to request services online, so online appointment booking that exists built in within the CHR. This could be through the desire for the patient to share information for the visit, digitizing the intake process, digital health questionnaires, again, built into the collaborative health record. This could be through a secure portal where you might want to, for example, send a patient their test results, or you might want to be able to check in on them after prescribing a medication to see how they're doing. All of these different ways that we think about engaging the patient are all built within the CHR itself. So the example that's shown on the slide here is simply around the fact that the patient being able to have a voice in the record can be a completely different paradigm for how efficiency can take place in the practice. For example, you might send a digital health questionnaire relating to someone's concerns about their mood. And within that, there may be questions about their general health and a PHQ-9. This information can be securely collected. This can be collected sequentially between visits, perhaps right before a visit, and you can plot and trend this information over time where there's a scored tool. And ultimately, the platform has the ability to convert this information, these patient reported responses, into a clinical note that can then dramatically reduce the amount of time I, as a provider, spend documenting because the platform is intelligently able to use patient reported information. So, how do all of these patient engagement tools actually deliver value and difference within the context of the CHR? One of the big advantages of the CHR is because these tools are built within the system, because they're functionally built in and not add-ons or something that's added after the fact, it allows for the development of entire workflows where patient engagement can create automation in stages of care delivery. An example might be an online appointment booking request coming in for a patient relating to a diabetes visit, that triggering a pre-visit diabetes questionnaire. That diabetes questionnaire triaging particular scores and determining that the patient could follow up with a nurse practitioner as opposed to needing to follow up with the physician. Prior to the patient coming in, specific tasks being sent to the patient through workflows, which could allow the patient to, for example, report their blood sugars or to watch a specific video. And then when the clinical encounter itself takes place, auto population of the notes through natural language. So that's simply one example of how all of these different tools can actually work in synchrony to deliver efficiency. So as a physician practicing on the CHR, not only do I benefit from efficiency in clinical notes being pre-populated, but I also benefit from the fact that the structured information that patients are providing is going into the right places within the health record. So an important point is not to necessarily see this information as free text coming into a visit, but rather as information that can directly go into the appropriate parts of the health record. For example, let's say someone is asked to update their smoking history. They might say, well, I was smoking a half pack a day, I'm down to 2 cigarettes. When this is asked in a questionnaire, not only can this pre-populate when I'm checking in with them during a visit, but it can also go into the social history field within health profile within the CHR. Then what I simply need to do is validate that entry rather than being able to be concerned about typing or clicking or manually entering the information to the right field. So it's saving me time, but it's also collecting high quality structured information, which can then be used for quality assurance purposes. It can be used for clinical research. It can be used for being able to support clinical decision-making tools in the future as well. Another important functional aspect of the CHR is that it was designed to meet the needs not only of individual clinics and practices, but also of large care teams, of networks, of health systems. It's already been deployed as a solution across large public health units, large family health teams, national clinic chains, and now presently we're working on deploying this solution at a provincial scale in Atlantic Canada. This is collaboration at a macro level, being able to have a single patient ID or record for a patient across an entire geography and dealing with the very pressing issue of duplicate records and disparate information, something that we're working very hard to being able to tackle. So what makes the CHR ideal for this sort of large care team network-based delivery? First of all, it is a true cloud-based solution. So there's no local installation or infrastructure, additional infrastructure that's required. The way that the platform is built is that it's built on best available web-based technology. So it's designed to be able to scale. And in design, it also has the ability to handle multiple physical locations on one domain. So it's not designed to be one record or one platform for one physical location. In addition to that, the ability to define different user types and different permissions for those user types allows the platform to be able to have hundreds of users within the platform and within the network if necessary. One of the most timely and relevant elements of the CHR is the fact that embedded within the platform is a complete virtual care solution, allowing you to have a range of different options for engaging patients directly from within the record. And that's an important point. You don't have to open up a different platform. You don't have to open up a different browser screen. There is multi-capability virtual care within the platform. So what does this mean? So of course, there's secure audio or video. If you'd like to directly have a call with the patient, you can do that within the patient's chart without opening another screen or having to log into a different system. There's secure messaging and instant chat. There could be file sharing. There could be digital consent. All of these things, again, can take place within the health record itself. So you're actually able to view the note, view different parts of the patient's chart, while as you can see on the left hand of the screen here, you can interact with the patient via video or to be able to interact with them asynchronously through things such as messaging or file sharing. Another important attribute of the collaborative health record is that it not only allows you to be able to collect high quality structured health information, but it also allows you to visualize this information and effectively to be able to make use of it. So this means information is available to you both at the level of an individual patient as well as at the level of an entire population. Also, because the patient is actually reporting information in a structured format, that information itself can be utilized over a period of time. So for example, you could trend someone's quality of life over time and have this visualized directly from within their health record itself. So you could be in an encounter with the patient and then see a graph that's showing their functional activity, their physical activity, their outcome scores. This information could also be used to be able to power different types of calculators or clinical decision-making tools, something like the Framingham, or perhaps a custom score that's being utilized for a specific patient cohort. At a population level, this can allow you to be able to filter and screen through your entire patient population to be able to identify those that, for example, qualify for colon cancer screening. Or perhaps you want to identify all the patients between a certain age group who qualify for the COVID vaccine. You'd be able to make these sorts of queries and visualizations within the platform with ease, but also to be able to act on them. The platform allows something called mass actions, which would allow you to not only identify that cohort, let's say all the individuals that qualify for colon cancer screening, but then also to be able to send them communication en masse. Perhaps you want to send all of them a questionnaire that provides them information about what colon cancer screening involves, and it allows them to click on a link to be able to book an appointment to take action on that. All of this can be done without taking tons of time from your staff, and it can be done to be able to ultimately improve the quality of care that your patients are getting as well. Now, one of the foundational principles of the collaborative health record has been to hold a higher standard of integrity when it comes to transparency and handling of health information. So this means beyond simply checking boxes such for regulatory criteria such as FOIPA, PHIPA, PIPEDA. We've really wanted to be stewards, to be thought leaders in the space of privacy and security. And part of that comes down to distilling our position on this quite simply. So many of us have, of course, taken the Hippocratic Oath when we were in medical school. First, do no harm to patients. We've taken that same simple but principled approach towards health information. First, do no harm to health information, to health data. And this pertains to both security as well as privacy of this information. So what does this mean practically? We don't sell personal health information to third parties. In addition to that, we want to develop systems where patients can ethically and through informed consent actually allow sharing of information when there are appropriate circumstances. For example, if there's a publicly funded clinical study taking place and patients want to participate in that, they should have mechanisms of being able to do so. We have no interest in stopping clinical research from happening, but we want to promote ethical mechanisms for that to take place and for transparency to be preserved. And that's a very important part of the philosophy behind the collaborative health record. So let's take things back to Joe. How was Joe able to benefit from the fact that the collaborative health record was being used in my practice? First of all, Joe was able to ebook his follow-up appointments with me. He had an easy way of being able to access those appointments without having to worry about phone calls. Joe agreed to recurring questionnaires to measure his mood and his quality of life. And he also had access to a mood diary through the patient app, which is available through the collaborative health record. I was able to pull recent labs through OLIS since the CHR is connected to provincial lab systems in Ontario. I was able to ask a question through internal messaging to an internist colleague at the practice within the CHR to see whether or not Joe actually needed an extension in the amount of dual antiplatelet therapy he was receiving. I was also able to send Joe a message about sleep hygiene and mindfulness through the patient portal. So all of these were things that we talk about in terms of care coordination, in terms of care delivery, that were actually facilitated through the CHR in this case. And this is just the beginning in terms of what the CHR is going to be able to do to better be able to engage patients and to be able to make visits more efficient. As some examples about what might be coming down the road, in the future, Joe would be able to see his treatment plans or be able to see a summary of the notes from visits so that he can jog his memory and remember what we actually discussed during those conversations. In the future, Joe may also be able to engage in virtual group visits for therapy. So these are just examples about the fact that this is an ongoing journey. The platform is going to be continuing to enhance the ways in which patients and care teams can interact. So as we draw our conversation today to a close, I wanted to leave everyone with a quote here. And this is by Dr. Atul Gawande, whom many of you know, surgeon at the Brigham and Women's Hospital in Boston, Massachusetts, professor at Harvard, and of course, a writer and author of the Checklist Manifesto. Medicine has become a team-based sport. So how do we treat it like one? Similarly, health records that we use on a day-to-day basis need to be able to respond to this reality. They need to allow us to be able to deliver medicine as a team. So we're at the footsteps of a journey that continuously is pushing the boundaries of how we can make practices more efficient, of how we can allow healthcare systems to better collaborate, to better communicate, and how we can move the needle forward in ensuring that the technology available today and tomorrow helps patients receive the best care they possibly can. It's a journey I hope that you'll take with us. Please don't hesitate to reach out to myself, puneet.seth@telus.com, or to be able to go to this link, telushealth.com/EMR, if you want to find out more information about the CHR, about other TELUS Health EMRs, or about one of the many patient engagement solutions that are offered as well. Thank you all very much.